Material in this video contains content included in the RBT Test Content Outline, 3rd edition, TCO. B.1. Conduct preference assessments. James, an RBT, was assigned to work with Sophia, a 9-year-old girl with limited verbal skills and minimal engagement during structured tasks. The supervising BCBA asked James to conduct a preference assessment to identify activities and items Sophia found most reinforcing. By doing so, James would gather the information needed to design effective interventions to increase her participation in learning activities. James reviewed the assessment procedures with the BCBA and learned about 3 main types of preference assessments: paired stimulus, multiple stimuli without replacement MSWO, and free operant. The BCBA explained that paired stimulus assessments involve presenting 2 items at a time to identify clear preferences. MSWO would help rank preferences by removing chosen items, while free operant would measure how long Sophia interacted with each item when given free access. James prepared a variety of potential reinforcers, including sensory toys, small puzzles, and favorite snacks. During the assessments, Sophia frequently chose tactile and visual toys during the paired stimulus trials and spent the most time with a sensory ball during the free operant assessment. James recorded the results, summarized them, and shared his findings with the BCBA, ensuring Sophia's intervention plan would include her top reinforcers to increase motivation. Preference assessments are used to find items, activities, or experiences that a client enjoys. These items are likely to function as reinforcers, which are things that increase the likelihood of a behavior happening again. Knowing a client's preferences helps motivate them to participate in tasks and makes learning and behavior programs more effective. Preference assessments are important because they help identify reinforcers, which are the foundation of effective applied behavior analysis, ABA. Reinforcers increase the likelihood of desired behaviors, making them essential for learning and progress. By using items the client prefers, tasks become more enjoyable, which encourages positive behavior and greater engagement. Preference assessments also provide a foundation for creating personalized intervention plans tailored to the client's needs. There are several ways to conduct preference assessments, including paired stimulus, MSWO, MSWI, and free operant procedures. Each approach helps identify what a client enjoys the most by using a structured process. These assessments are essential for finding the most effective reinforcers to use during therapy. Step 1. Gather items to assess. Select a variety of 5 to 7 items or activities that may interest the client. These should be chosen based on the client's age, preferences, and developmental level, such as sensory toys, puzzles, or music. Having a wide range of options ensures the assessment can capture the client's natural preferences. Step 2. Create an accessible environment. Arrange the selected items or activities in a way that allows the client to easily access and explore them freely. Make sure the area is calm and free of distractions to help the client focus. The setup should encourage natural interactions with the items without prompting or instruction. Step 3. Observe client engagement. Allow the client unrestricted access to the items for a set amount of time. Observe and record how long the client interacts with each item, noting the duration of engagement for each. This data shows which items naturally hold the client's attention the longest. Step 4. Avoid prompting choices. Let the client choose which items to interact with and for how long, without offering guidance or prompts. This ensures the results reflect the client's true preferences rather than influence decisions. It also reduces the risk of escape-motivated, elopement behaviors, as the client can freely move between items. Step 5. Analyze and summarize results. Review the recorded data to determine which items the client engaged with the most. Items with the longest engagement times are likely the strongest reinforcers. Use this information to identify reinforcers that can be incorporated into therapy sessions to improve engagement and strengthen newly learned skills.
Key takeaways for RBTs conducting preference assessments. Understand the purpose and procedure. Each preference assessment serves a specific purpose and follows a unique process. Understanding whether to use paired stimulus, MSWO, MSWI, or free operant procedures ensures the assessment is appropriate for the client's needs. Discuss the procedure with the BCBA to ensure proper implementation and reliable results. Prepare materials and environment. Gather all necessary items such as toys, snacks, or activities, and ensure they align with the client's preferences and developmental level. Set up a calm, distraction-free environment to help the client focus during the assessment. Preparation minimizes disruptions and ensures the process runs smoothly. Follow systematic steps. Each assessment method has structured steps to follow. Offer items systematically for paired stimulus, MSWO, or MSWI, or allow unrestricted access during a free operant assessment. Consistently follow the steps outlined for each method to ensure accurate and valid data collection. Record and summarize data accurately. Use data sheets to record client choices, engagement times, or item rankings based on the assessment method. Summarize findings into clear categories such as high, medium, and low preference items. This information guides the BCBA in creating reinforcement plans tailored to the client's preferences. Preference assessments are a cornerstone of effective ABA interventions, and RBTs play a critical role in conducting them accurately and consistently. By identifying reinforcers that truly motivate clients, RBTs help unlock learning potential and foster engagement in learning activities. The various types of preference assessments, including paired stimulus, MSWO, MSWI, and free operant, all provide unique insights into client preferences. The results of these assessments guide interventions that are tailored to client needs. Through careful preparation, systematic implementation, and precise data collection, RBTs ensure clients receive the individualized support they deserve. By conducting preference assessments accurately and often, RBTs create opportunities for growth and progress, making a lasting impact on clients' lives and their success.